Good evening. Welcome to another edition of Urban Renal Talk with Tamika and Steve. I am your host, Steve Belcher. Thanks for joining us. We were supposed to have, and we still may have on guest Leon Smith Bay. Again, technical difficulties. This has seemed like to be an ongoing issue, but not on our part. Let me just uh, future guests, if you come on, it's suggested to use a Android phone when appearing on our shows. For some reason, we're having problems with guests using their laptop computers. I had a test run with Leon just yesterday, and everything went well. Now today, things are not going well. Hey June, how you doing? Thanks for tuning in. So please, June, if when you come on the show in January, please, if you can use an Android phone, that would be the best way to do it. But if you got to use your laptop, you know, that we want that to be the last resort because we're starting to have issues with our guests using laptop computers. So Leon is still trying to work behind the scenes and coming on the show. If not, uh, right now I'm going to start a education moment, which affects a lot of patients, even people that are in stage, any stage of kidney disease go to the hospital. Dialysis patients go to the hospital. Some stay overnight, are hospitalized, some aren't. But this is information that I think each patient should know before they go to the hospital if that has to happen. So preparation that you can do right now that is truly important that you should know, especially now. The reason why I say that, my dad, he's in the hospital, major hospital in DC, and there's patients when the doctor comes in, they may ask you questions about your medication or, you know, who's your primary care physician or you seeing other doctors. And that's good information to know when you go to the hospital. So the first on the list for preparation you should know before you go to the hospital, if you have to go, is one, a list of doctors. That's really important. Carry a list of doctors in your wallet. Uh, you can write them down, type them up, whichever is creative and convenient for you. The hospital can use this list to alert your doctors and collect your medical history quickly. I don't know about quickly, but they can get a medical history if you don't know your whole medical history. Also, remember to keep the list updated if your doctors change. We know many kidney warriors see many patients. You may see the optometrist, you may see a gastroenterologist, you may see an endocrinologist, the vascular doctor, host of other doctors that may come into play, and you want to make sure each doctor is aware of what the other one is doing. Like they say, let the left hand know what the right hand is doing, because sometimes when patients see multiple doctors, such as my dad in the past, he was getting different medications, and he was keeping track of that. So it's very important if you're seeing multiple doctors to make sure that each doctor know what the other is prescribing. And even if you have a parent that is seeing multiple doctors, it's definitely good to keep track of their medication to make sure that they're not being over medicated or having medication they may be contradiction to each other. Number two, as I just mentioned, a list of medications. Carry a list of medications and their dosage in your wallet or your loved one's wallet or pocketbook. The list will help the hospital give treatment, know what they're taking. There won't be no conflict in the medication. That's very important to make sure either you or your loved one have an updated list of medication that they can carry to the hospital if they need to go. Number three, an emergency bag. That's important as well. Pack a bag with a couple of days worth of comfortable clothes and toiletries. Also, having your own clothes at the hospital can make you feel comfortable. How many people, I know I had to take my dad some clothes, but how many people have loved ones that's in the hospital, or you go in a hospital and you don't expect to stay overnight, and then something that you think you may not stay ends up you being there for a week, and having your own clothes just makes you feel normal instead of having a hospital gown with the back open um, and the those booty socks that they have with the grip pads underneath. So have a bag just in case, so you won't have to scramble for clothes. It's almost like a what they call a bug out bag or emergency bag if you have to evacuate. Evacuate. Same concept, but this would be just a hospital bag if that day comes that you need to go, if that ever happens. So going to the hospital, if you don't feel well and you have a question, you can always call the dialysis or doctor. Um, and they pretty much can tell you, which they are going to tell you to go to the hospital. And for a lot of kidney warriors, and we see this as well, if you feel sick, if you have a temperature, you have diarrhea, you have vomiting, or you just have symptoms that really, really take you out, it is truly and highly recommended to go to the emergency room instead of coming to the dialysis clinic, because a lot of the staff at the facility, they know how to treat the symptoms, but they're not going to know what the underlying uh, problem is. Now, some people may have nausea and vomit because of depending on if you miss treatment or you just have these symptoms on a regular basis. If you ate something, fluid overload, not feeling well. But if you have um, nausea, vomiting, flu-like symptoms, temperature, uh, other symptoms like that, you should definitely go to the ER instead of coming to the dialysis unit, because what's going to happen when you come to the dialysis unit, they're going to call a doctor, and more than likely they're going to give you a treatment. Okay, they're going to make sure they get that treatment, and then they're going to send you to the emergency room or call 911, which I mean could have happened in the first place. So just be mindful of that. This is very important. If you need emergency hospital care, call 911. We all know that. I mean, that seems so simple, but a lot of people don't do it. If you don't feel good, 911, okay? Or have someone drive you to the hospital. Very, very important. Don't just sit around thinking that some of these symptoms may go away, because a lot of times they don't, and they end up causing other problems as well. And we all know that heart disease is tied with kidney disease. So there are problems that go along with the heart disease, uh, kidney disease, one thing that a lot of people don't understand, depending on what stage of kidney disease that you're in, your kidneys can lose the inability to produce a hormone called erythropoietin. What erythropoietin does is a hormone that stimulates the bone marrow to produce red blood cells. Now, if your kidneys are not working like they should and they can't produce this hormone, erythropoietin, then your bone marrow is not producing more red blood cells, and which is causing what's called anemia, CKD anemia. So what they do to correct that problem is give you a man-made synthetic hormone called epogen, and they give you that if before you start dialysis. If you need that, you get it by injections. If you're on dialysis, we give it to you through the machine as kind of like an IV push. So that's very important to know. And so when you go to the emergency room, you definitely want to let them know that you're a dialysis warrior, dialysis patient. Let them know when the last time you had treatment. This goes as well as if this is a family member and you're taking them to the ER. Um, if you're too sick to go to the hospital, have someone take you. That's very critical. Don't attempt if you're not feeling well to take yourself there, especially if you're diabetic and you're known to be really susceptible to hypo, which is low blood sugar, or hyper, which is high blood sugar, which in either case a person can feel tired to the point of um, fainting uh, with that. So just really be careful if you don't feel well and you think you need to go to the ER. I highly suggest calling 911. Don't worry about the bill, or calling a family member or loved one to transport you to the ER. This stuff is serious. When kidney disease kind of gets to the point where it start affecting other organs and producing other symptoms and other problems, it's time to definitely go get checked out. Some of these symptoms you may not even notice. They may even mimic other problems. So that's why you can't ignore this, especially if you're at risk for kidney disease. Um, Definitely show the hospital your medication cards if you do have them. Let them know what you're taking so that nothing gets um, confused. Also, this is very important. If you go to the hospital and you have to get admitted, if you could remember, either call a dialysis unit or have a family member call a dialysis unit and let them know that you're in the hospital. Because if we don't know that you're there and we're setting up and preparing for you to come in and we don't know that you're in the hospital, it's pretty much a waste of supply. So I have Leon in um, my lobby. However, I can't see the brother's face. So, Leon, if you're watching this show, I can see you in the lobby section. However, I cannot see your picture on the screen. Okay, so definitely sorry about this. We're gonna probably have to reschedule Leon. He's still trying to attempt to get on. So again, if you're going to be a guest on the show, please, if you have an Android phone, please use that. The last resort is a laptop, as each time that a guest uses a laptop, we always end up with some type of technical difficulties at the last minute. Okay. Um, let's see. I got another person. See if I can get her. So I'm not sure if my partner popped in, Tamika Moore. That was a surprise. You may be able to see her, but I can't. So if y'all see her, wave. I can't see her. So um, Tamika, if you can hear me, I can't see you. I have you. Okay, she popped back down. Same here with Leon. I can't see you. If you can see, okay, here we go. Hey, what's going on?
Hello, I can't see anybody.
We can hear you. I can hear you. Hey, what's going on? Can you hear me?
Still can't see anyone. It's weird.
We can hear you. We can hear you. Tamika, I can see you.
Let me try to go out and come back in.
We got Tamika Moore
I'm
back,
gonna go
y'all.
out. Okay.
See, this is how the enemy works.
What the freak
He
is going
tries to
on?
stop the broadcast. We're trying to bring positive kidney disease awareness information, and that's what the enemy does. He tries to destroy, the information from getting out there, but that's not going to happen here. You're seeing this live. She's trying to get on. Okay, they can hear you, Tamika. Yeah, see, we're going to get this right. We're going to definitely get this right. Okay, let's. Hey, can you hear me? Tamika,
Hmm.
can you hear me? Hey, Tamika,
Okay, so they
I
can't
want to
hear me.
text you.
All right.
I want to text you.
All right. Um, shit. So why can't I hear?
Yeah, I'm texting her.
Can I hear?
So while she's getting this, and y'all can hear this as well, I'm gonna keep on going with the education. So again, when you're in a hospital, if your loved one is in a hospital, have them call the dialysis unit and let them know that you're in a hospital if your loved one's in, so they'll know, and be aware that. Um, Also, when you get discharged, if you could bring your discharge papers with you from the hospital, they give you that. So we know if they changed any medication, uh, if you need to get any antibiotics, anything like that. Still trying to get Leon on. He's popping up in my lobby section, but we can't see his face. Uh, that's just how this goes. We're live. Let's see. We got Tamika popping back in. Hey, Kelly, how you doing? Thank y'all for tuning in. So we're gonna try this one more time with my girl Tamika, my partner. Hey, Tamika.
I don't know what's going on. I can't see you guys. I'm gonna try from another phone. I don't want to interrupt anyone talking.
We can see you and hear you. Yeah, y'all. So this, hey, this is how it goes. But if you're coming back, if you're coming back from the hospital, make sure that you bring back these discharge papers. It's called a discharge summary. It has a list of medicines that you received in the hospital. Um, if you're getting any antibiotics, post dialysis because you may have been hospitalized due to an infection, um, any changes in your treatment. So definitely bring that. It's called a discharge summary. Um, Also, this is important, and the hospital should know this as well. Um, if you have a graft or fistula, make sure that they're not taking any blood pressures or drawing any blood out of your access, especially if you have small veins. That's very important because what we have seen is personnel that does not have experience, even though it looks easy that you could probably draw blood from it. But these people have no dialysis training whatsoever, uh, and then you're not supposed to draw anything out of that access unless it's coming out of a needle cannula. So definitely do not let anyone draw any blood, take any blood pressures on your access arm. That's very, very important. So we definitely had the surprise of bringing Tamika Moore, and she was going to share, her story and everything that would happen throughout her pregnancy. But unfortunately, um, you see how this works with technology. I just say it's it's the enemy, and when I say the enemy, meaning spiritual enemies, because we're doing positive things, trying to get out positive information to help people that's going through this that may be in one of the stages of kidney disease, whether it's stage 1, 2, 3, 4, or 5, or even at the point of receiving dialysis. We try to give and disseminate or put out that information to address all aspects of kidney disease. That was the one reason why we started Sunday Morning Transplant Coffee Talk, because we wanted to address the transplant community as well, not just with um, donor awareness, uh, but also hearing the stories of people who did have transplant and that transplant rejected, or people who are waiting on the list that's been on the list for multiple years, or people who had successful transplants that are leading um, great lives and moved on or doing advocacy. So we wanted to shed light on each one of those aspects of the transplant process, as we call it. And coming up next week, we have a new show uh, December 11th, and every Tuesday following that at 9, from 9 to 9:30, Sisters Against Kidney Disease with host Sorrel George out of Atlanta, Georgia, kidney warrior who's on board with Urban Kidney Alliance to host that show. And what Sisters Against Kidney Disease represent is women, and doesn't matter what color you are, but women who deal with this disease on a daily basis and also just deals with life, um, women's issues. One in particular that I just want to uh, uh, just share just a little bit about that is not really talked about in the dialysis unit is women who may still have menstrual cycles that don't let the staff know that may receive heparin, which is an anticoagulant that helps your blood move through the dialysis circuit. Now, I'm sure that it could be maybe some embarrassment on it, depending on who the nurses are, if you got male nurses, and then it may not be no embarrassment on letting the nurse know. But however, the staff or the nurse needs to know that. So if you are on your cycle and you do get a large amount of heparin or blood thinner, I mean, it could be up to 4,000 units, and you don't know this, but when you're, on your cycle, you're having a large amount of bleeding and you don't know why, then you can tie the two together and say, oh, that's okay, that's what it is. But these are the kind of issues that we're going to be talking about on Sisters Against Kidney Disease. We're talking about caretakers, um, uh, from daycare, how women who have kidney disease, who have children, if they don't have anyone to help babysit, who watches their children, how do they manage all that? This disease is starting to spread. I'm starting to see a lot of facilities out here. A lot of younger people are starting to come on dialysis, and it's really becoming the norm. And so this is I'm sorry if I'm whispering. Thank you, Kelly. This is so serious that it we have to hit it from all angles now. It can't just be talking about prevention, but also when people are in those stages of kidney disease, what you can do to halt the progression. Okay, let's see what's going on.
Hey,
Let's see. Hey,
hey, just don't put my name up. I'm using Nick's phone.
oh, we can hear you.
Okay, good.
You on? Hey, we got Tamika Moore on.
Finally,
What's
finally.
going on?
Hello, everyone. Shoot.
Hey, Tamika, what's going on?
Good,
We
Steve. Long
miss you,
time.
man. I
I
miss you so
know.
much.
I know.
What's going on? Share with the audience what you've been up to.
Having a baby. Having a baby, yes.
How that's been like?
Adjustment after 13 years.
Uh-huh. Uh-huh.
Major adjustment. But it's
Man, we everybody miss you. They send their prayers.
thank
Everyone is saying hello. What's
thank
going on? Welcome back.
thank you. I
Man,
appreciate it.
it's been a rough one.
Yes, yes, having babies over 40 is not fun. And lead it to the younger generation.
You look bright.
Thank you.
I mean, I remember when oh man, you look so good. Your
Thank
face,
you.
you look marvelous.
Thank you.
Wow.
Thank you. That stress of carrying that baby was taking its toll on me. It was
I
taking
know, I know. but you
Yes.
made it through.
Yes, I
Have you?
did. Thank God.
Yeah, we having some trouble with the guest. He using an iPad and another laptop, and
Yeah.
we did a run through yesterday, and I was able to see him and talk and everything. And today I can't see his face, but he's in the lobby section.
Right. That's where I was at, and I couldn't see you. And so I grabbed another phone because I tried to do it through my phone and it wasn't working. I tried to do it through my laptop and it wasn't working. So I grabbed another phone and it started
Uh
working.
huh.
So
Uh huh.
it's always something, like the devil's always busy. So whatever, it's
Yeah,
always
yeah.
something. Especially when you're going live, like there's always things that go on that are really not under our control. So
Oh, absolutely, absolutely. So, have you been watching the shows?
yes, off and on while I'm up. Yes.
Uh
Um,
huh.
I see you
So,
had
has
Tamika
it
last year.
has it been one that's been memorable to you since you've been gone, or
Tamika
one that rings a bell, or
Tamika Smallwood, because she's continually trying to grow, even with her illness. She's in school. She's trying to grow versus letting her illness control her. She's controlling it.
uh huh, uh huh.
Instead of her making excuses, she just keep finding a way to progress versus stay stagnant.
Right, right. So you heard about the um new show coming up, Sisters Against Kidney Disease. That's what we was just talking about.
Yes. So fill me in on that one.
Yeah, Sisters Against Kidney Disease with host Sorrell,
Mhm.
who is a kidney warrior um that I interviewed on the show. I don't know if you've seen her interview, but I saw her video just in another group or something. It just automatically popped up, and I was like, wow, she is really on point, really out there, doing advocacy.
Right.
But I thought she would be a good host for that particular show. But Sisters Against Kidney Disease is the concept was to shed light on women that's dealing with the disease
Mm-hmm.
on a daily basis and in the different aspects of their life that they still have to take care of, like child care
Yes.
and
Yeah.
working and just being a parent and just other responsibilities on top of having this disease, as well as talking with caretakers, as we will be talking with Stephanie Stevens
Mm-hmm.
Tuesday, who take out of Fredericksburg, Texas, who take care of her mom
Mm-hmm.
at times, taking her maybe to dialysis or visiting her. So
Mm-hmm.
it's just a show to highlight women, different women who deal with this disease and how they deal with it, and hopefully give other women um, strength and hope to deal with it in a positive way as
Right.
well. We had uh, nurse practitioner on that had a kidney pancreas transplant.
Mm.
Yeah, out of Jacksonville, Florida. Okay, so we lost Tamika for a moment. Again, we got Leon. Let me see if I can see him because he's saying that he's on. We got Tamika back.
It's okay.
Hey,
It's
Tamika.
okay. Things happen. Hey, we're gonna keep moving.
Yeah,
Okay. And you know what, Steve? That platform is needed because a lot of times no one talks about the sexual aspect of kidney disease in women, just like in men. But there's no conversations to talk about that or dating, because there's certain things that changes with the woman that women share amongst themselves, when it comes to
hmm
having kidney disease. And it's not a big topic that's in the unit or that the health providers usually talk about. They don't talk about what's happening with their body, but their body no longer does, or you know,
Tamika.
yes.
This this is getting serious. The kidney disease. It's really, really getting serious. Um, More units are opening up, and still don't see any advocacy on a national scale. I mean, have you seen any up in Philadelphia?
No, but Steve, why would they have advocacy if it's bringing in money? Like, they're not going to advocate for it because it's bringing in money. You figure one treatment is $1,300. That's just a treatment. That's not talking about the or that's just one treatment. $1,300. You go 13 times a month. That's one person. You have units in Philadelphia that has 52 stations. Well, 52 chairs.
Wow.
Mm-hmm. 3 times a week. I believe it's the one in Chester has either 48 or 52 chairs. It's a huge unit.
How far are you from Chester?
I am maybe 35 minutes from Chester, if that.
I used to
If
work at Chester Crozier.
Okay, so you know how many chairs Chester Crozier has.
Yeah, I used to work in a hospital part. I worked over at the unit a couple of times, but yeah, that's
And if
crazy.
if they have three call outs, it's dangerous because there's so many patients.
Right, right.
Mm-hmm. Mm-hmm. But they're not going to advocate on it. They're not going to give you much education on it because it's money. They're
Yeah,
not
I
going
was
to tell
looking at some of
people
the comments.
right. They're not going to tell people to take potassium pills. No, they're going to give them Lasix. So they're not giving you anything that's going to stop the progression of kidney disease. They're not going to tell people who have high blood pressure to start to take potassium pills. They're not going to tell them about the beta blockers that they need. Like, they're not telling them, they're not educating them on it. So yes, you're going to have more and more kidney failure.
Mm-hmm, mm-hmm.
They're not going to
So,
tell the diabetics that they need potassium because the more they urinate, the more they peeing out potassium.
so Tamika, Kelly, she had made a comment, which
Mm-hmm.
I thought it was interesting. She says when you said they're charging 1,300, she says that's cheap. She thought it was 4,000 a treatment.
No, the last time I looked, it was like $1,300 a treatment, unless Kelly's getting a whole lot of extra stuff done. But if she's on Medicaid, they only can charge a certain amount, and it's 1,300. It's like the
But if you
average.
got private insurance, they can
They're
charge
gonna
up to
charge
maybe
you up.
4,000,
Yes.
right?
Yep. They're gonna charge you up.
But Medicare only reimburses $240.
Mm-hmm.
Oh, June Carpenter said 4,500 per treatment.
4,500. Okay.
Yeah, but either way,
Is that
that's a
with
lot of money.
is that with Medicaid or
Oh no,
private
no,
insurance?
just in general. Like for instance, we did a show. We did a show on when they was doing the voting on Proposition 8.
Mm-hmm.
And so one of the things that came out of that with these companies was they were using American Kidney Fund. Well, let me take that back. They were having patients go into Obamacare.
Mm-hmm.
Do you remember it was a time when these large organizations were having patients switch from Medicare when Obamacare first started to
Mm-hmm.
Aetna or United Healthcare,
Yep.
and they were able to bill them up to like 25 to 4,500
Mm-hmm.
per treatment.
Right. That's why I was asking, was it private insurance? Because like there's a certain amount that they can only charge Medicare.
Mm-hmm.
That's why they have like
Yeah,
Part A and Part B. But it's
yeah,
sad either way, no matter what the cost is. It's sad you figure how many treatments you have a month. Let's say from 11 to 13, unless they're twice a week, and how many people is on the machine. Like, they make millions and millions of dollars on kidney disease patients, people on
right,
dialysis,
right.
and home hemo too, and personnel. Like, they make big money off of this right here, this sickness. Well,
Yeah.
illness rather.
But you know what, Tamika? I was thinking that even though this is happening like it is, that you can almost not turn it around, but start to try to, you know, as well as doing the prevention,
Mm-hmm.
people that has been diagnosed and on it, try to keep them, keep their GFR as low as possible
Right.
to, to prevent the inevitable. Uh,
And not just
you know,
that, them taking vitamin D. Like if you're taking vitamin D in the unit, you need to take it outside the unit too. Like there's no reason why you're just taking the vitamin D pills in the unit and not outside the unit. That doesn't make sense.
mhm,
But
mhm.
a lot of patients don't know that because the doctors aren't telling them. The doctors aren't educating them. The staff isn't educating them because some of the staff don't even know.
Wow. Why do you think that is?
Sometimes it's just a check, Steve.
Right, right. But do you think it's because the staff could be overworked? There's so many patients that you can't reach them all.
For one, you would have to care to educate.
Say that
You
one
know,
more time.
for one, you have to care to educate.
Right, right,
You
right.
know, some people are just there for a check. So if you're just there for a check, you're going to do the bare minimum. You're not going to go above and beyond to educate them because they're not telling us that these patients need to take vitamin D outside the unit. It's once we've been in the field and done research to be like, hold up, well, if they're giving it to you there, you need to take it outside the unit too. And then if you ask your doctor, he'll be like, oh, yeah, you could take it outside the unit too.
Mhm, mhm.
So it's all in them educating themselves a little more to educate the patients. But people aren't going above and beyond like that. They're just there for the 12 or 16 hours and then they're going home.
Mhm, mhm.
Unless it's a personal thing to it, then yeah. Or you do have some technicians that really care. But you have some that don't. It's just a check. I was one of those technicians until my son got sick with nephrotic syndrome. I was like
Mhm.
that for like a year and a half. It was just a check until he got sick and my eyes opened up like, hold up, wait, maybe I need to change some things, because he's them now. He can be my patient.
Right.
So
Wow.
I had to change how I dealt with my job. It was no longer a job, it was personal. So this is a personal mission. It's just not for a paycheck or anything like
Mhm.
that. It's a personal mission.
Yeah, I agree. I was the same way. I'm not gonna lie. I was the same way until I started Urban Kidney Alliance, and when I went into the unit and saw and realized I went into a 30 chair unit, and every chair was filled with a black person.
Hmm.
And again, I know this disease affects everyone, but when you have a whole unit of one entire race up to 30 chairs, and then you're talking about times two more shifts, um, it was a wake up call for me
Hmm.
to say I need to do everything I can to spread awareness because people are being diagnosed and don't even know that they had a disease. And by the time they are diagnosed and find out, it's too late for them. And they
Well,
could have did something about it.
well, for one, minorities need to go to the doctors. They need to stop using Aunt Sally's home remedies and go to the doctors. That's where we fail as people because we're not going to the doctors like we should.
Hmm.
We'll
Hmm.
drink some tea or drink some soursop or something, a old time remedy, instead of going to the doctors and seeing what's wrong. And then
Right.
sometimes we don't get a second opinion when we know that we're having an issue. We don't go get the second opinion. And then the other thing is not having insurance.
I know. I know.
And then we also had to advocate for ourselves because I'm gonna give you a situation that happened when I was in labor. The lady put my epidural in wrong. She told me She was like, "Oh, well, sometimes it just go to your back." I said, "Ma'am, I done have 4 children. I have never had a epidural just stay in my back. It always come down my leg. Now, if I didn't advocate for myself, that epidural would have stayed localized in the small of my back versus me being strong with what I was saying and made her redo that epidural. And
Mm-hmm.
then it started working the way it was supposed to. But I suffered for like 5 hours in pain because she tried to tell me that that's how I was supposed to feel.
Mm.
So I had to advocate for my own self and let her know, like, no, you're going to fix this.
Mm-hmm. Mm-hmm.
And when she fixed it, it worked fine.
So, do you think now with the increase in clinics that there's been an increase in inexperienced workers in the field?
Yes, because when you read the advertisements or for jobs, they say you could come with no experience. And the little 3 months that they give you in a room is nothing. You got people lives in your hand. 3 months is not long enough.
Mm-hmm. Did it used to be that way when they advertised? No, come with no experience.
No, you had to have like a CNA background. I don't know because they trained me off the streets. So I literally
Okay.
came in off the streets, but I was going to a nursing school in Jersey. So I had an option whether to be a receptionist or be a dialysis tech.
Mm-hmm. Mm-hmm. No, you're right. I agree with you. Um, they got these different programs out now, and I mean, they're pretty much hiring anybody. And I mean, when I came in 1985, I mean, even though I didn't have no medical background, I did go to medical assistant school
Right.
for 2 months. But it meant something when you learned it. You trained and you really paid attention. I mean, we didn't have all the technology that they have nowadays. But Tamika, I mean, this is serious when you have people on cell phones, on social media, paying attention to the phone and not listening to alarms going off and machines stopping
Mm-hmm.
and no one's around. I mean, how serious is that?
You know, Steve, that's serious, but was even more serious that when it's a power outage, that the new people don't know what they're doing because they never
We
been in
talked
that situation.
about that with emergency
Mm-hmm.
evacuation.
Mm-hmm. Or they don't know how to change a bag, so you have a bag with no saline in it, and then the patient cold, the blood pressure drop. You giving the patient air and not even noticing because you're too busy rushing. So there's just a lot of different things that can be approved. I'm sorry, it's a lot of things that can be improved, but it starts at the top. And also, the patients have to be their own advocate and they have to know what's going on so they can speak up on it. Because if they don't, whomever's taking care of them, if they're half step, and they're going to continue to half step because you didn't speak up for yourself.
Hmm. Well, what about the people that can't speak up? Who would speak up for them?
The nurses need to be there.
I know. Mm,
Unfortunately, even though it's more on the nurses, like the nurses or hire someone to work with some of the older people
right, right.
because a dialysis center is so critical that things happen in a matter of an instant and there's
Mm,
never enough staff.
I know. I mean, and as time goes on, I think it's going to even get worse because people who's been doing it for a long period of time, like yourself and me, and other people, moving on to um, other aspects of this business, then you're going to have other people coming in and doing this. They got dialysis schools out there now trying to profit off of it,
Hmm. Not
and
trying, they are. I think those schools are like $7,000.
then if you go to one of the facilities, they're just going to retrain you again.
Hmm. They're going to train you on the machines. You're going to be back there with the books and stuff like that. You're probably not going to have a mock code. Some things that they're not going to show you that you have to learn on an experience. Well, when you learn on experience, who life is that?
Mhm. Mhm. Mhm.
You know, who life is that you're learning on? It's somebody's life that you're learning on. You're not learning on a dummy.
Yeah. What would you say to this comment? Madonna, she was a guest on Sunday Morning Transplant Coffee Talk last week.
Mhm.
She says then they tell them you get a bonus if you stay with them for a certain amount of time. And
You
I'm
get a
trying to.
cash bonus after they tax it. You might as well not have gotten anything.
Oh, right. Like the sign-on bonuses.
Mm-hmm.
Yeah, yeah. And you don't really get all that money. It's just
No.
after the taxes and they
Mm-hmm.
give it to you in increments.
Yep. Yep. So all that is basically your gas up. That's just to sucker you in there. But I think if everyone was aware of what happened before they got kidney disease, you know, like they can tell their story to someone else that can help them go get help before they even touch the machine. Like I believe that there's different avenues that everyone affected with kidney disease can take to
Right,
pass on to help the next person.
right, right.
Because this
Oh,
disease not
Madonna.
this disease right here takes a village because we would never conquer it. But the thing is raising awareness to it and letting people know like, hey, this is out there. Change your eating. Do this, do that to give yourself a better life.
Yeah, I agree. Madonna, she says my unit recently tried to get me to sign a paper stating they trained me on how to take myself off the machine in an emergency, and I wasn't even at the unit that day. I was in another state.
So Madonna, no. Say to them it's fraud. And if you say fraud, they'll walk away and won't look back at you. Tell them it's fraud. Say, no, I'm not signing that. I wasn't even here that day. Nope. Don't sign it.
Yeah, I mean, and they will try to would do that. I mean,
I've done it.
no, I've seen it.
Mm-hmm.
Um, you know, that's unfortunate, and that's another thing. You know, you got people who don't know how to take themselves off, and you know, if that actually ever happens, and you know, it sets up a lawsuit.
Yep. But if you sign the paperwork, it doesn't set up a lawsuit because you signed that you knew what you was doing. So in case it doesn't work out for you, you signed it.
Yeah,
You
that's true.
signed it.
So that's
Mm-hmm.
why we do what we do. I mean, we definitely stand on the truth and try to make sure if you're going through this that you know every information you need to know to make a informed decision of what's
Right.
going on. And
Right. Steve, I think like if people ask their doctors more questions, like I learned with my whole situation with me being pregnant, the more questions I asked the doctor, the more they would stumble. Like the more they didn't have any answers for me. So because you don't have any answers, I don't want that blood transfusion. You know,
mm,
why am I getting this blood trans? Why y'all trying to give me a blood transfusion? Well, because we seen your levels were low. Well, where are my levels? Well, no, that's not low enough for a blood transfusion. Can you give me some iron? You know, so when you're aware of what's going on with your body and you ask questions, you're in control of your illness. And a lot of times these doctors don't know anything. They don't know what you think they know because a lot of them are students.
mm, yeah, and uh, yeah, and that goes the same with not just with obstetrics, but with kidney disease when people go in the
Yes.
hospital
Yep.
and
Or
yeah.
even with this, Steve, the emergency room cannot diagnose you with hypertension. Why are you taking those meds? So you got these people that went to the emergency room for something and their blood pressure was high because they was in pain. Well, the first thing they want to do is give them high blood pressure meds. So then the patient is going to keep thinking that they have high blood pressure and going to continue to take these meds. So then they're going to get a primary care. And they're going to tell the primary care what medicine they take, and they're going to say that they have hypertension when they don't have hypertension. And now you have people taking meds for hypertension and they don't have it.
Mm.
And they're messing their body up because they don't have it.
Wow. Wow.
Mhm.
I mean, just multiply that times all the, emergency rooms and just everything that's going on.
But it happens all the time. When you go into the emergency room, you always come out with more meds than you went in there with. And they cannot diagnose you with hypertension. Like, you need to have a repeat occurrence of high blood pressure before they can say you have hypertension. If you go in there and it's 185 over 105, but you're in pain, that's your pain bringing up your blood pressure.
Mm-hmm.
And
Mm-hmm.
it's not like you have a history with them where they can say, oh, well, yeah, we see there's a pattern of hypertension. We're going to give you this med. No, they'll ask you this: is your blood pressure always high? And then someone be like, well, I don't know. Well, what's your blood pressure? I don't know. Automatically they're going to say, okay, well, you may have hypertension, and you don't have any of it. You just don't know anything about your body.
Wow.
Mm-hmm.
Wow. That's why education is very important.
Yeah.
And that's, yeah, yeah. And that's why we do what we do. I mean,
Right. And that's why sometimes a lot of people that's on dialysis shouldn't even be on dialysis.
I agree. I agree
They shouldn't even
100%.
be on it. There's no way a person that's supposed to come 2 times a week comes once every 2, 3 months and they have bad kidneys. No, it's something else going on, but they weren't diagnosed properly.
Mm-hmm. Yeah, I talked with someone just recently. It told me that um, they got started on dialysis early and then they got taken off for like another year and a half. Then they went back on.
Right, right. And then what they tell them is, well, the dialysis treatment is going to help. No, the dialysis treatment is not going to help that somewhat healthy kidney. It's going to make it worse on that
It's gonna make it
healthy
worse.
kidney. So
Yeah,
don't believe that when they say, well, we're going to do this. And then, like, when people get transplants, oh, we're going to jumpstart their kidney. Well, you knew from the beginning when you inserted that kidney that kidney wasn't working. Because
right.
a good kidney, you don't have to jumpstart. So now you're going to jumpstart this so called jumpstart this kidney for 3 days a week and praying that it works.
Yeah, yeah, and that happens in a lot of the
Mm-hmm.
inner city hospitals. It's
Mm-hmm.
unfortunate. Um, just had a gentleman that I talked about that recently returned to dialysis after 6 years
Mm-hmm.
with a compromised kidney, and I mean he knew it was compromised, but he he was on dialysis for up to, I believe, 13 years,
Mm-hmm.
and he was just tired.
Right.
And I mean, I can't blame him because I probably would have done the same situation if I didn't, know if I wasn't a healthcare worker and didn't know dialysis, and if I had a opportunity to get off dialysis and take that, risk, I would more than likely would have done it.
Right.
And
Right.
so, we talked about compromised kidneys in one of our shows, and this is starting to become a phenomenon as well,
Mm-hmm.
especially with a lot of people who are taking kidneys that are Hep C.
Right. And another thing that's making these also compromised kidneys more and more is there's a lot of people that overdose.
Right. We had one young lady who was watching the show the other day that said that she received a transplant from a person who OD'd.
Mm-hmm. And it's more and more, especially in the inner city, because it's a huge heroin epidemic.
Mm, mm.
Mm-hmm.
I mean, that's another show right there because I'm sure it's arguments on both sides when it
Mm-hmm.
comes to um, accepting those type of organs that could possibly be affected by some type of drug that the person OD'd off of because depending on how that drug is metabolized, if it's
Mm-hmm.
excreted through the kidneys or the liver,
Mm-hmm.
it can have some damage that you probably won't know about until,
It's in there.
later.
Yep. But they don't have enough time to do the testing that's really needed because they have to get that kidney out sooner than later. So
Hmm.
they call different units and say, we have a kidney, is compromised, the person OD. You don't know how long that person's been taking drugs because no one really asks, well, how long that person been taking drugs? All you hear is that, they overdose.
Hmm.
You don't hear anything else.
Yeah, Kelly must be from Baltimore because she, especially in Baltimore, that's why she's hesitant. Um, yeah, even
Yes.
the two main hospitals here in Baltimore is Hopkins and University,
Mm-hmm.
and they both do have compromised kidney programs
Right.
where they don't tell you the rejection. They just tell you the success rate
Right.
of the operation, but don't tell you how many people may have rejected off of the
Mm-hmm.
compromised kidney.
Right. And that's
So,
what they do. They tell you how many they implanted, but they don't tell you how many was rejected. They don't tell you how many went back on dialysis. They don't tell you how many died. They don't tell you the other statistics. They just tell you how many was transplanted from one body to the next, and they were able to close them up with no complications. They checked it off, and then days later, there's no checkoffs.
hmm hmm. Oh, uh, Kelly, she's right up the street from. We have a viewer, Kelly Kaz Ray. She's up the street in a
Oh shucks.
different. Well, Baltimore is kind of at the city, then out in the county,
Mm-hmm.
and I'm in Randallstown, and then you have other little cities, and she's in Woodlawn, which is, I mean, not even 10 minutes from me.
Oh wow! You know it'd be dope, Steve, if you and her meet at the coffee shop on the day that on Sunday.
What, this Sunday?
No, any Sunday for
Oh
Sunday
yeah,
morning
yeah.
coffee talk.
Yeah, Kelly, I want to do that. Maybe talk with her and do an interview.
Yeah, face to face. Yep, that'll be so decent.
Oh, speaking of that, I'm on the road Sunday in Delaware, in Smyrna, Delaware, at St. Paul AME UMAME Church on East 141st Street, I think it is.
Mm-hmm.
I had an address, but it's in Delaware. I'm doing the kidney disease awareness tour there.
Oh wow! Send me the information.
Okay, that's this Sunday, like 2 o'clock.
Okay, send me the
Yeah, yeah,
information.
yeah. I definitely text it to you.
Yes.
Yeah,
Yes.
yeah. So it's like about
But
10:15. I got work in the morning. I know you look like you getting a little
okay.
tired.
Yeah, I don't want people to see I'm leaking.
Oh, wow.
Cause I'm nursing.
You something else, right? Right. It's
Listen,
all
I don't
good.
want listen, I
Oh, I
decided
will,
to
Kelly.
nurse.
I inbox you. We could definitely maybe meet up at the Panera Bread on Security Boulevard.
Yeah, have
You
a good
familiar with
Sunday
that?
morning.
Right over there by the the Kaiser building. So, but yeah, Tamika, definitely look forward. More shows, raising more
Yes.
awareness. You're back. I
Yes, I'm
mean,
back. Y'all may see a baby on my shoulder from time to time. Excuse me.
oh,
As my mother.
absolutely. We got to prep Zoe to be a advocate.
Yes, 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 yes. Get her some kidney disease
How was
awareness.
the baby? Share with the audience before we leave out how the baby's doing. We saw pictures. I showed them pictures, and everybody loved the pictures.
She is doing good. She's just very tiny. She came 37 weeks, so she's still small. She's not really gaining a whole lot of weight. So, but she's good. She's a crybaby, but she's good. It's been a
That's
long time,
great.
Steve. It's been 13 years. I don't know what I was thinking. I don't know.
Oh, that's okay. No, that's all right. We look forward to seeing her grow up in front of the camera. No, I
Yes.
just kidding.
Yes. Yeah, but we will see y'all next week. And
Yeah, yeah, absolutely. With a new show and actually
yes,
this Sunday, I'll be in again, Smyrna, Delaware. So we won't have Sunday morning transplant coffee talk this Sunday.
right.
So,
Nick.
all right,
Yeah.
Tamika.
All right. See y'all next
Welcome
week.
back. Glad you
Thank
back. I'm
you.
serious, man. You just don't
Thank
know.
you. Thanks for the
Hey,
baby.
tell Nick I said hello.
I will. Hold on 1 second.
Okay, hold on, y'all. Oh my God. Woo! Let me put you
Kiddo.
on solo.
She's here. She's
Oh,
asleep. Yeah, my little Zozo. Mm,
baby Zoe. Oh man. Thanks.
yes. You're welcome. All right. See y'all next week, Steve. I got it next week.
All right, all right. I'll talk to you soon.
Okay.
All right, good night.
All right. Good
Yeah.
night, everybody. See y'all next week.
All right. So yeah, June. My dad. So y'all, let me just give you an update on my dad. Um, I mean, he's stable. My dad has heart disease. He's getting old. I mean, he's 89 years old. Um, he's stage 3, stage 4 kidney disease. GFR is about 39%. And I mean, he's holding on. And all I could do was put it in God's hands. God knew what he was doing when he created us. So it's already been predestined. The hardest thing for me has been working as a dialysis nurse and seeing other people going through, other families going through exactly what I'm going through right now, being at the bedside, seeing their loved one hooked up, um, or me doing the treatment in the ICU on a patient that may have heart failure, getting fluid off, having some confusion, or a sundown syndrome, which older people get in the hospital. So I'm, experiencing that. But at the end of the day, God is still good. Um, I'm still going to deliver this information and still do what we do. So, June, thanks for asking. I appreciate your thoughts and prayers for my nephew and my dad as they recover. And we just go on with this journey of our life. So, wish me luck. Um, again, Sunday, there won't be Sunday morning transplant coffee talk as I would be in Smyrna, Delaware at St. Paul UAME Church doing the kidney disease awareness tour. So we'll see you Tuesday for Sisters Against Kidney Disease with host Sorrell from 9 to 9:30 on Urban Outreach, Urban Health Outreach Media Facebook page. And then we have a show 8 o'clock from 8 to 9, Smashing Kidney Disease. I'm going to have Curtis George out of Lancaster, Pennsylvania on as well. So tune in for the launch of Urban Health Outreach Media. Thanks for tuning in. We see y'all then. Good night. God bless.